Hi, I'm Alice Lee. I'm a holistic psychiatrist practicing in Gaithersburg, Maryland, and I want to welcome you to my YouTube presentation today. I want to also invite you to subscribe to my newsletter as well as to this YouTube channel, where I will present a lot of useful information for those people who are interested in a holistic approach to their mental health and towards finding greater joy and authenticity and health in their lives. Today I wanted to present something that I've been looking forward to sharing for a long time. It's what I consider to be a revolutionary leap in my own development as a holistic psychiatrist in helping my patients come off medications. Not only that, but I believe that this approach is accessible to people because it's so simple to do, and also because it's not costly. So anybody who is able to understand the concepts are able to use this intervention to help them. But I wanted to go ahead and start from the beginning, and today's presentation will come in two parts. The first part will be underlying the difficulties that I've encountered over time with medication withdrawal and some of the limitations that I found to be present with a functional medicine approach. What I mean by a functional medicine approach is the approach using supplements or other natural products to help a person withdraw from their medications. I still use them, but I believe that by using the intervention that I'm going to be talking about, that it will make the functional approach less critical in terms of the ability of someone to come off their medications. So let's go over what has to happen in order for a person to successfully withdraw from their medication. There are two underlying things that must be addressed. The first, of course, and this is the part that most people are focused on, and that is the body's dependence on a prescription medication. So whether it's one prescription or two, the body gets acclimated to that medication, becomes tolerant to it, and starts to need the medication on an ongoing basis. That's dependency, medication dependency. And that's what most people come to me being aware of and willing to work on. The other aspect of medication withdrawal is the underlying causes which cause that individual to need a medication in the first place. These are the underlying causes. These underlying causes may be the root reasons for a patient's inflammation, oxidative stress, and deteriorating health over time. And these underlying causes aren't necessarily treated just by taking a prescription psychotropic medication. These underlying factors cause the body to respond in such a way that it sends a message to the person that they're not feeling well. That message is what is being blocked and buffered against by the psychotropic medications that we have today. Treating the messenger is not treating the underlying cause. And therefore, in order for a person to truly be well and to be able to come off a medication, a holistic clinician will approach the problem with attention on both paths. Number one, healing the underlying causes, and number two, healing the medication dependency. Today I want to talk about how to help a person actually become less dependent on the medication, assuming that those underlying causes have been resolved over time. For example, a patient may come in after being on a medication for a decade, and over that decade, that individual may have been very careful about diet and exercise and have resolved many of the causes that had increased inflammation and oxidative stress in their lives. So those individuals then can really focus on how to come off their medication without spending an exorbitant amount of time trying to address underlying factors. So let's focus on just that, how the body is able to do that. With functional medicine, we can use certain herbals, supplements, glandulars to support the body so that the body can become less dependent on that medication. Up until now, that's what I've been doing. I would add these various supplements to match what the medication is doing, and then I would lower the medication a little bit when the patient is showing signs of being over-medicated. Once the medication is lowered, the body will adapt in an organic, natural way, and the receptors will come down in some ways so that they can become matched again. And then as the person continues to heal through some of the interventions that are natural, the need for medication will come down, and then we lower the medication to match that, and then this is the process. So what happens is that a person's need for medication will come down. I will lower the medication, and then as they continue to heal, the need for medication will come down again, and then I will lower the medication again. This adaptation is a very kind of a gradual, slow process, and you don't want to lower the medication in big chunks or too fast or too many at a time. However, there are some medications that are very hard to lower in this way, either because they affect too many receptors at the same time, or because the withdrawal side effects always result in severe negative symptoms such as pain or anxiety or problems with severe insomnia or appetite. So if these types of medications, every time you lower it, can cause these withdrawal side effects, it can make it very difficult for a clinician to move forward with the medication withdrawal. So I have looked at this problem for a long time. In fact, I've been in holistic medicine for now since 2002, so it's been about 18 years. And what I've discovered is that in the field of energy medicine, where we work with information and energy flow, and we understand the body as almost like a computer system that uses information and energy in very intelligent ways, I can use some of the tools in energy medicine to help patients to lower their need for the medication. The way I do this is I teach patients how energy in energy medicine can inform the body to do things differently using certain techniques. And the technique that I've been using recently is called EET plus logosynthesis. And you can find it on my website. It's a combination of EET, which is Empower Energy Technique, and logosynthesis, which is a series of statements and intentions. When I combine these two techniques together, it allows the person to magnify their ability to use their mind and their intentions to help inform the body so that it can prepare itself for a medication lowering. The EET logosynthesis sentences go like this. I now choose to align myself with life energy and be empowered to retrieve all of my energy bound up in, and we insert the problem in here, and I bring this energy back to the correct place within myself. After this first statement, you'll take a few breaths, and then you go on to statement number 2. I now choose to align myself with life energy and be empowered to retrieve all of my energy bound up in all of my reactions to this problem, whatever the problem is that you insert here. And I bring this energy back to the correct place within myself. And then you take a few breaths. I usually take about 2 to 4 breaths. And then you go on to statement number 3. I now choose to align myself with life energy and be empowered to remove all non-me energy bound up in the problem. I remove this non-me energy from all of my body, being, and personal space. And I send this energy back to where it truly belongs. And now what I ask patients to stick into that space where the problem is supposed to be inserted is this statement. The codependent reactions of my body that keep the medication at a homeostatic dose and interfere with my ability to easily, safely, and gradually taper down on, you can state the milligrams of the medication, from the current dose to the desired dose by a certain date. So you will state this specific date. And I will go over that particular technique with the patient. Now, in energy medicine, life energy, the alignment of yourself with life energy is the idea of being aligned with perfect energy. This is an infinite field of energy that provides all of the information, ability, and function that you need. So it is an idea of that. So when you align yourself with an idea like that, it's opening you up to a connection to this infinite source of energy. So the person will do this EET plus logosynthesis. They will do their energy breaths twice a day, and then they will do a recording called Minimizing Medication Withdrawal Track. There's a long version, which is about 15 to 20 minutes, that my patients will do once a week, or they can choose to do the abbreviated version, which is only about a minute, but they have to do that every day. So once they do the energy piece, which informs the body and helps the body to become less dependent on the medication, and they take some of the supplements that allow their body to create enzymes and to allow them to be able to follow the information in a physical way that is helpful for the withdrawal. With those two combined together, patients are able to lower their medications much more easily and straightforwardly without significant pain and suffering or withdrawal problems. But again, I just want to emphasize that part is only for medication dependency. If there's a lot of underlying factors that are not healed, that does need to be addressed, or else it will interfere with the way in which the withdrawal can happen smoothly. So I hope that this is helpful for you. Again, please sign up for my newsletter, and I hope you'll subscribe to my YouTube channel. Take care and have a great week. I will talk with you soon. Thanks. Bye-bye.